Hi everyone. On behalf of the entire Senior Dental Care team, I would like to welcome you to this webinar today. My name is Jeannie Jandak and I've been a practicing dental hygienist for 29 years. I currently work for Senior Dental Care in nursing homes in the Chicago area. I absolutely love caring for my patients and I'm excited to bring this information to you today. In today's webinar, I will explain various oral health conditions that you may encounter with your residents, as well as the best way to deal with these issues. Oral health can have a profound effect on your residents' overall health, both physically and emotionally. For this reason, it's important to be aware of conditions that can affect your residents' oral health. I would like to start out by discussing a common oral condition that can cause daily discomfort for residents. This condition is called xerostomia, or dry mouth. Dry mouth can be a side effect of a variety of medications. Residents receiving radiation therapy for cancer can also suffer from dry mouth. It is prevalent in residents with diabetes, as well as those who have autoimmune diseases like Sjogren's syndrome. Alzheimer's patients are more prone to dry mouth as they may not drink enough water because their body's signal for thirst is not as strong as it once was. Residents who sleep with their mouth open will often suffer from dry mouth, and dry room air can also worsen dry mouth. Dry mouth can cause mouth tissue to burn and be irritated. Dry mouth can make chewing and swallowing difficult, and it can also cause the tissue to stick to the teeth, which makes talking difficult. Let's talk about what saliva is and why it's important. Saliva is a tasteless, odorless fluid. It's slightly acidic and viscous, and it's secreted into the mouth by glands. Saliva is important because it keeps the mouth moist and comfortable. It aids in chewing and swallowing, as well as tasting of food. Saliva fights germs in the mouth, which helps prevent inflammation of oral tissues and gum disease. Saliva has proteins and minerals that protect tooth enamel and prevent tooth decay. Saliva can also help dentures stay in place. So what can you do to help your residents get some relief from dry mouth? Help your residents keep their teeth and mouths clean. Daily brushing of teeth and cleaning of removable appliances such as dentures and partials is very important. Make sure residents are drinking enough water. And place a vaporizer in their room to add moisture to the air, especially during winter months when the heat is on. Have them use mouth rinses and gels designed for dry mouth, such as Biotene. Let's review how to use Biotene for dry mouth. Biotene rinse may be used after brushing, both morning and evening, as well as any time of day for comfort. An oral swab dipped in Biotene can be used if a resident is unable to rinse. Biotene gel may be used as needed to lubricate oral tissue and is especially effective before bed to increase comfort while sleeping. Simply squirt about a teaspoon of the gel into the resident's mouth and have them move it around with their tongue. They can spit out any excess if needed, but don't let them rinse with water afterwards so you don't rinse the gel out of the mouth. An oral swab can be used to apply the gel as well if necessary. Consistent daily use of both Biotene rinse and gel is recommended for maximum effectiveness and comfort of the resident's oral tissue. Inflamed, swollen gum tissue is another oral condition that can cause discomfort and pain for a resident. Gum tissue inflammation can be caused by excessive plaque, calculus, and food debris around teeth and gum tissue. Swollen, inflamed gum tissue can also be caused by an infected tooth. It's important to note that if you see a raised pimple or mass-like swelling in the mouth, a dentist should be notified as soon as possible. What should you do if a resident presents with inflamed, swollen gum tissue? Clean the area with a toothbrush, oral swab, or washcloth to remove plaque and food debris. Clean between the teeth with floss or an interdental pick to ensure there is no food debris lodged between the teeth. Use an alcohol-free antibacterial mouth rinse such as Listerine Zero to irrigate the area. For swelling or inflammation that does not subside, or if the resident's face or lymph nodes are swollen, have the resident see a dentist as soon as possible for proper evaluation. Dentures and partials can often cause issues for residents as well. Denture stomatitis is an inflammation and redness of the oral tissue underneath a denture or partial. Often you can see the red outline of a resident's denture or partial on the tissue after removing it after removing the appliance if they have stomatitis. Oral candida, or a yeast infection of the mouth, is associated with denture stomatitis. Denture stomatitis can be present with or without white patches. There are a few things that can cause denture stomatitis: plaque on a denture or partial, not removing a denture or partial at bedtime to give the tissue air and rest, and poorly fitting our old dentures. Here's what you can do to prevent stomatitis. Clean the denture or partial daily by soaking at night with a denture cleaning tablet and brushing thoroughly to remove plaque and food debris. Make sure the denture or partial is taken out at bedtime to allow the resident's tissue to breathe and rest. Keep the oral tissues in the mouth clean of plaque and food debris. If the resident has stomatitis and it does not clear up on its own, an antifungal medication such as nystatin may be needed. Make sure a dental exam is scheduled as soon as possible. Another common issue for residents with dentures and partials is sore spots. These occur when the tissue under or around the denture or partial gets irritated from either food debris being trapped underneath the denture or the denture rubbing against the tissue. If a resident complains of a sore spot, remove the denture and rinse it under cool water to remove any food debris. Inspect the tissue for redness or irritation. Keeping the denture or partial out of the resident's mouth after meals to give the irritated area a chance to heal is recommended. If the tissue is only slightly irritated, a small amount of adhesive placed on the denture or partial in the area of irritation can be used to cushion the area during eating and prevent further irritation. However, do not apply adhesive if the tissue is blistered or bleeding. If the tissue is severely inflamed, torn, or bleeding, irrigate the tissue with warm water and keep the denture out as much as possible to help the area heal. If the area does not heal or wearing the denture continues to cause irritation, please have the resident see a dentist as soon as possible. An adjustment of the denture or partial may be necessary. Angular colitis is a condition that occurs when saliva pools in the creased tissue at the corners of the mouth, causing redness, irritation, and cracked tissue. Candida or yeast-type fungus can also grow in the area due to moisture from the saliva. Angular colitis can be bilateral or unilateral. It can extend onto the facial tissue, and it is often seen in denture wearers. What can be done to treat and prevent angular colitis? Vaseline or a protective ointment applied daily, especially before bed, can help prevent and treat mild angular colitis. If ointment does not help, an antifungal may be necessary. Consult a dentist or physician for the best treatment options. Candida or oral thrush causes white patches, usually on the tongue or inner cheeks, but these white patches can also occur on the roof of the mouth, the gum tissue, and the back of the throat. Oral thrush can cause loss of taste. In severe cases, redness, burning, or soreness may also occur. And this may make it difficult for the patients to eat or swallow. Oral thrush is common in people with compromised immune systems or in residents whose natural body flora has been altered by antibiotics. Evaluation by a dentist or physician is recommended for the best course of treatment. Dry, cracked lips can be very uncomfortable for residents, causing discomfort when eating and talking. Here are some things you can do to help heal and prevent dry, cracked lips. Keep the lips dry of saliva. Lubricate lips daily, especially before bed, and avoid products with menthol or camphor, as these can cause more dryness. And advise the resident to avoid picking at their lips. Let's discuss the difference between a cold sore and a canker sore. Cold sores can develop inside and outside of the mouth. Canker sores only develop inside the mouth. Cold sores are contagious. Canker sores are not contagious, and both can be painful. Cold sores appear as a single blister or cluster of blisters. Canker sores can appear as a single round sore with red edges and a light center. Cold sores can be treated with ointments, lip balms, and sunscreen. And antiviral medication can also help cold sores heal. Canker sores can be treated with ointments and mouth rinses. Both cold sores and canker sores usually go away on their own within 1 to 2 weeks. However, consulting with a dentist or physician is recommended if healing does not occur within a reasonable amount of time. Black hairy tongue is caused by too much bacteria or yeast growth in the mouth. This can develop in residents with poor oral hygiene. It can also develop after antibiotic use, since antibiotics cause an imbalance of bacteria. Residents who are dehydrated and have dry mouth can also develop black hairy tongue. It is more prevalent in men, HIV patients, and intravenous drug users. Most of the time, black hairy tongue can be treated by improving oral hygiene conditions. Brushing the top of the tongue twice a day or using a tongue scraper is recommended. In severe cases, a dentist should be consulted for additional treatment options. Today I have shared with you examples of common conditions that your residents may present with. If you are unsure of the oral condition a resident has, or if you are unsure of the best course of treatment, please consult a dentist or physician as soon as possible. You can contact Senior Dental Care to access our telehealth option as well by calling our main office at 877-674-1211. Ask for a clinical support manager to make a telehealth appointment. On behalf of the entire Senior Dental Care team, I want to thank you for joining me today. There will be a brief survey following this webinar, and your feedback is greatly appreciated. I hope you will join us next week when Shelley Anthony presents our next webinar entitled Oral Care Products and Aids, a Caregiver's Guide. Now I would like to answer any questions you may have about today's webinar. I have one of our dentists, Dr. Flesher, as well as a fellow hygienist, Shelley Anthony, standing by to help answer your questions.